Today we are going to start our surgical anatomy series regarding the skull and the brain. We will start by the craniocerebral topography, and in this video we will look at the lateral surface of the skull to study only 4 craniometric points, and then we will continue studying the other points and parts in a step-by-step manner in the following videos. On the lateral surface of the skull, we will see 4 important craniometric points. They are depicted here on this diagram. They are ordered as A, B, C, and D. Point A is the anterior squamous point. It represents the most anterior point of the squamous suture. It is the site where the squamous suture is connected to the horizontal line of the edge of the pterion. This point corresponds to the tip of the pars triangularis of the inferior frontal gyrus, and this relation is nearly constant in all human beings. This point does not have only a topographic importance, but also it has a surgical importance. At this point, the sylvian fissure becomes more deep and more wide. This is because of the inward retraction of the tip of the pars triangularis. So it is the safest point for the start of opening of the sylvian fissure in case we choose to open the sylvian fissure from lateral to medial. Let's take a look on point B. It is the superior squamous point, i.e., it is the most superior point of the squamous suture. This point on the skull surface corresponds to an important intersection on the brain surface, which is the intersection between the central sulcus and the sylvian sulcus or the sylvian fissure. So you understood that this point is the lowest point of the central sulcus, and this is right. For this reason, it is called the inferior Rolandic point. If we draw this horizontal line from the porion and stop at 3 cm, then we draw a perpendicular line from this point and stop at 5 cm, we will locate the inferior Rolandic point, which again corresponds to the most superior point of the squamous suture. Now let's take a look on point C. It is the Stephanion. It is the site of intersection between the coronal suture and the superior temporal line. We should notice that the superior temporal line on the skull surface is parallel to the inferior frontal sulcus on the brain surface. So the Stephanion is at the level of the inferior frontal sulcus. We can use the Stephanion in the rough localization of the motor speech area, as you will see later. But now let's take a look at point D. Point D is about 2.5 centimeters posterior to the Stephanion along the superior temporal line. It corresponds to the meeting site between the precentral sulcus and the inferior frontal sulcus. As I mentioned before, the superior temporal line is the projection of the inferior frontal sulcus. This point is about 3 cm above the sylvian fissure. Now we can know how to roughly localize the motor speech area as follows. If we draw a line connecting the 4 points to each other, we get a rectangular shape. If we add another 1 centimeter width in the anterior direction to this rectangle, here we get the rough localization of the wider motor speech area. These 4 points represent the central craniometric points of the lateral surface of the skull, and this is to be continued. Thanks for watching.